Hey everyone, welcome back. Tonight we're diving into a topic that's all about you, your health, safety, and well-being as an EMS professional. It's called Workforce Safety and Wellness. And trust me, it's not just another chapter. It's the foundation of a long, resilient career in this field. You see, this job isn't just physically demanding, it's mentally and emotionally tough too. From lifting patients to processing stressful calls, every shift can take a toll if we're not prepared. That's why developing good habits and a solid support system early is so important. All right, let's take a quick look at what we'll be covering tonight based on the National EMS Education Standard Competencies. These outline the key skills and knowledge areas you'll need to build a safe, resilient career in EMS. We'll start with medicine, where you'll learn how to apply fundamental knowledge to provide basic emergency care and transportation for acutely ill patients. This means we'll focus on using assessments to make quick, effective decisions in the field. Next, we'll dive into infectious diseases, where you'll learn how to decontaminate your equipment and ambulance after treating a patient. This process protects you, your team, and future patients from harmful pathogens. After that, we'll touch on the preparatory section. We'll explore how to understand the EMS system, stay safe, and handle your medical, legal, and ethical responsibilities. These are the core principles that keep you effective and professional. Then, we'll focus on workforce safety and wellness, which will be central to tonight's discussion. We'll talk about using standard safety precautions and personal protective equipment, PPE, managing stress and coping with difficult situations like death and dying, preventing injuries, whether from lifting, moving patients, or responding to calls. Finally, we'll cover the principles of work-related injury prevention and wellness and resilience. This will include learning proper lifting techniques, understanding how diseases spread, and building habits that promote long-term health and success in your career. By the end of tonight, you'll have a strong foundation in these competencies and a clear picture of how to apply them in the field. Sound good? Let's get to it. Let's start with the big picture. To take care of others, we must take care of ourselves. This isn't just a nice idea, it's essential for doing your job effectively and staying in this career for the long haul. There are plenty of hazards that can affect your health, safety, and overall well-being. Recognizing them early is key. These hazards fall into three main categories. Personal neglect happens when we don't prioritize our own basic needs. Things like eating right, staying active, and getting enough sleep. Environmental and human-made threats include everything from dangerous scenes to chemical exposures. Even poorly maintained equipment can be a hazard. Thirdly, there's mental and physical stress. This field can be tough, and stress can sneak up on you if you're not paying attention. Managing it is crucial to avoid burnout and stay sharp. Here's something to think about. Your emotional well-being is closely connected to the well-being of your patients. In high-stress rescues, your reactions can set the tone for how things play out. When you stay calm and centered, it helps your patients feel safer and more secure. So as we move through this chapter, keep this in mind. Taking care of yourself is not a luxury, it's a duty. Let's explore how to make that happen. When we talk about health and EMS, we're not just talking about your physical condition. Health is the connection between your body, mind, and emotions, and it's all interconnected. Chronic stresses, whether physical, mental, or emotional, can increase your risk of developing serious health issues. This makes it critical to understand how to manage stress and promote wellness. Not all stress is bad. Some stress, called eustress, actually helps you. It can give you focus, energy, and even job satisfaction in the long term. Think of it as the push you need to perform well under pressure. On the flip side, distress is the kind of stress that drags you down, negatively affecting your health, mood, and performance. Wellness, on the other hand, is an active pursuit. It's about intentionally working toward a state of good health physically, mentally, and emotionally. And that ties directly into resilience, which is your ability to bounce back from tough situations and recover from distress. Want to build resilience? Here are some proven strategies. Eat well. A balanced diet fuels your body and mind. Sleep enough. Aim for 7 to 9 hours every day to let your body recharge. Strengthen relationships. Keep strong ties with family, friends, and colleagues. They're your support system. Stay active. Stretch, move, and exercise daily to stay physically strong and reduce stress. Practice mindfulness. Focus on the moment and work on cultivating positive habits. These aren't just good ideas. They're essential tools for thriving in a demanding career like EMS. Small, consistent actions add up to big changes over time. Stress is a part of life, especially in EMS. The good news? Stress doesn't have to run your life. Stress management is all about using proven tactics to reduce or eliminate the effects of stress, and tonight, we'll explore practical ways to do just that. One of the most effective strategies is to minimize or eliminate stressors where possible. For example, if a partner has a negative attitude, consider requesting a change. Adjust your work hours or even the work environment if it's contributing to burnout. Be mindful of how much overtime you're taking on it can pile up quickly and lead to exhaustion. But what about stressors you can't eliminate? That's when you focus on how you respond. Consider these options. Shift your perspective. In the military, we jokingly say embrace the suck. Try changing how you think about the stressor. It's not always easy, but it can be powerful. Talk it out. Sharing your feelings with trusted friends, family, or coworkers can relieve some of the pressure. If needed, don't hesitate to seek professional counseling. A neutral, trained perspective can work wonders. It's also important to avoid getting stuck on things outside your control, like frustrating situations with patients. Instead, focus on what you can do. Deliver the best care possible and move forward. Lastly, take steps to support your overall well-being. Build friendships and hobbies outside of EMS. It keeps life balanced. Limit stimulants and substances like caffeine, alcohol, and tobacco. They can amplify stress over time. Work on adopting a relaxed, big-picture mindset. Life is a marathon, not a sprint. By finding the right mix of these strategies, you'll be better equipped to handle stress and keep thriving in your career. Let's talk about nutrition. In a demanding field like EMS, what you eat can make or break your ability to handle long shifts, physical exertion, and mental focus. Start with the basics. Aim for regular, well-balanced meals. Your body works best when it gets consistent fuel, so skipping meals or relying on junk food isn't doing you any favors. Keep an eye on your intake of sugar, fats, sodium, and alcohol. These can sneak into your diet and leave you feeling sluggish or worse, lead to long-term health problems. The important thing to take away here is balance. Now, let's talk carbs for a minute. You've probably heard that carbs give you energy, but not all carbs are created equal. Complex carbohydrates found in foods like pasta, rice, and vegetables are excellent for sustained energy. However, too much of these can stick with you, literally. So save these for last when you eat. That way, you aren't devouring them all and overeating. They're a better option than sugary snacks, though, which give you a quick high and an equally fast crash. Make sure you're getting enough fibrous carbs from leafy vegetables, greens, etc. Fats are also a source of energy, but need to be healthy fats. Oreos don't count as much as I wish they did. Fats are useful in moderation, but they shouldn't dominate your plate. Try to make protein your primary goal. Finally, stay hydrated. This one's non-negotiable, especially with the physical demands of the job. Water is your best go-to for staying sharp and feeling good. Make sure you're drinking enough throughout the day, especially during long shifts or in hot weather. A good rule of thumb for proper hydration is half your body weight in ounces daily. So if you're 200 pounds, drink 100 ounces minimum. Your nutrition isn't just about how you feel today. It's an investment in your long-term health and performance. A strong body supports a strong mind, and exercise is a critical piece of that puzzle. Staying active doesn't just boost your physical health, it also makes you more resilient to stress and better prepared for the physical demands of EMS work. Regular exercise works hand in hand with good nutrition and proper hydration. When you combine these habits, the benefits multiply. You'll have more energy, better endurance, and a sharper mental focus, which are all vital in this line of work. To maximize these benefits, aim for at least 30 minutes of moderate to vigorous physical activity 5 days a week. That activity should include 3 key components: cardiovascular endurance to keep your heart and lungs strong, muscle strength building to handle lifting and moving patients safely, flexibility to reduce the risk of injury and improve your range of motion. Whether it's running, weightlifting, yoga, or even a brisk walk, find something you enjoy and stick with it. Staying active doesn't just help your body, it clears your mind and helps you recharge. Remember, relaxation is equally important. Taking time to recover and decompress is what allows your body to heal and your mind to reset. Together, exercise and relaxation form a powerful combination that can help you thrive both on and off the clock. Sleep is not optional, it's foundational to your health and performance as an EMS provider. According to the National Sleep Foundation and the American Academy of Sleep Medicine, adults should aim for 7 to 9 hours of sleep each night. However, studies show that half of EMS personnel get less than 6 hours of sleep in a 24-hour period, leading to severe physical and mental fatigue. The consequences are serious. In the short term, sleep deprivation can lead to medical errors, vehicle crashes, and increased risks to patients, coworkers, and bystanders. Over the long term, it raises your chances of developing conditions like hypertension, diabetes, sleep apnea, depression, and more. Fatigue and stress also feed into each other, creating a vicious cycle that can be hard to break. As a side note, researchers are studying a suspected link between poor sleep patterns and chronic issues later in life, such as Alzheimer's disease and dementia. While the science isn't definitive yet, it highlights the importance of making sleep a priority for your long-term health. Guidelines to help manage fatigue include using tools to measure and monitor fatigue levels, limiting shifts to fewer than 24 hours, providing access to caffeine and opportunities to nap during shifts, offering training to recognize and mitigate fatigue risks. You can also take proactive steps to combat fatigue, get enough quality sleep, take short naps during shifts if allowed, stay physically active balanced with proper rest, monitor your caffeine intake to avoid energy crashes, Engage your mind with conversations or games during downtime. For better sleep quality, try avoiding caffeine and nicotine 4 hours before bed. Ensuring your sleep environment is cool, dark, and quiet. Exercising earlier in the day and establishing a calming pre-sleep routine. Sticking to a consistent sleep schedule, even on days off. Sleep isn't just about feeling rested, it's about protecting your body, mind, and career for the long haul. Staying healthy in EMS isn't just about what happens on the job, it's also about the choices you make in your personal life. Let's talk about disease prevention, health promotion, and how they tie into habits like nicotine use, alcohol consumption, and drug misuse. Disease prevention focuses on medical care and proactive steps to reduce the effects of illnesses. On the other hand, health promotion is about your personal practices and social habits, things you can control to improve your overall well-being. One big topic here is nicotine use, whether it's smoking, vaping, or chewing. These habits are harmful across the board. Tobacco can lead to cardiovascular and respiratory diseases. Smokeless tobacco increases the risk of throat, mouth, and pancreatic cancers. And while vaping is often marketed as safer, it's linked to cardiovascular and respiratory illnesses too. If you're trying to quit, there are strategies that can help. Start by creating a plan to tackle the triggers that make you reach for nicotine. Set a quit date and let your friends, family, and coworkers know they can support you. Clear out tobacco and vaping products from your environment and talk to a doctor about additional resources. Alcohol abuse is another critical issue. Acceptable limits are defined as 1 drink per day for women and 2 for men, but excessive alcohol use is a major problem. According to the CDC, it causes 88,000 deaths annually in the U.S. and costs over $200 billion a year. Most of that is tied to binge drinking, which also damages your cardiovascular, hepatic, immune, and central nervous systems and increases cancer risks. Finally, let's address drug use. This includes both prescription medications and illicit drugs, both of which can be abused or misused. The CDC reports that drug abuse costs the U.S. more than $190 billion annually in lost productivity, healthcare, and crime. A career in EMS demands a lot physically, mentally, and emotionally. That's why finding a balance between work, family, and your personal health is absolutely essential. Without it, burnout can creep in, and your effectiveness on the job can suffer. One way to create that balance is to rotate your schedule whenever possible to give yourself meaningful time off. Regular breaks help you reset, recharge, and reconnect with your life outside of work. Taking vacations is another critical piece. Time away is not just a perk. It's a necessity for maintaining perspective and energy. It's also important to recognize when work stress starts to feel overwhelming. EMS can be a high-pressure career, and it's okay to admit when you're struggling. If that happens, seeking help isn't a sign of weakness. It's a smart, proactive choice that can make all the difference in preserving your well-being. By taking steps to balance these aspects of your life, you're not just protecting yourself, you're ensuring you can continue to show up fully for your patients, your family, and yourself. Understanding infectious and communicable diseases is critical for protecting yourself, your coworkers, and your patients in the EMS environment. While these terms are often used interchangeably, there are key differences. An infectious disease is caused by organisms within the body, like bacteria, viruses, or fungi. A communicable disease, however, is one that can spread not just from person to person, but also between species. Think about illnesses like the flu or certain zoonotic diseases that originate in animals but can infect humans. The good news is that the risk of infection can be significantly reduced. Immunizations are a key defense, along with using protective techniques and practicing good hand-washing habits. One of the simplest yet most effective tools for stopping the spread of disease. Let's review some important terminology. A pathogen is any microorganism that can cause disease in a susceptible host. It's the culprit behind infections. Contamination refers to the presence of these pathogens or foreign materials on objects like dressings, water, food, needles, or even on a patient's body. Exposure occurs when someone comes into contact with blood, body fluids, tissues, or airborne particles in a way that could allow for disease transmission. It's important to note that exposure does not equal infection. You can be exposed to pathogens countless times every day and not become infected, but the risk is there. This leads us to PPE, or personal protective equipment, is what stands between you and potential hazards. Proper use of gloves, masks, gowns, and eye protection is essential to keeping yourself safe. These concepts aren't just theoretical, they're the foundation for your day-to-day safety in the field. By understanding and applying these principles, you reduce your risk and improve outcomes for everyone involved. Understanding how infectious diseases spread is essential to protecting yourself and others in the EMS field. The method by which a disease is spread is called its route of transmission, and there are several ways this can happen. Direct contact occurs when pathogens are passed directly from one person to another. A common example is blood-borne pathogens, which can spread through contact with infected blood or bodily fluids. Indirect contact involves transmission via an intermediate object. For instance, needle sticks can introduce pathogens from one person to another by contaminating the needle or other object first. Airborne transmission happens when infectious agents are spread through the air, often by coughing or sneezing. Diseases like tuberculosis or certain viral infections can travel in tiny droplets, making airborne precautions vital. Foodborne transmission occurs when pathogens are ingested through contaminated food or water. Practicing safe food handling and hygiene is critical to preventing this. Vector-borne transmission involves an animal or insect carrying the disease. For example, fleas, ticks, or mosquitoes can serve as vectors for illnesses like Lyme disease or malaria. Recognizing these routes of transmission is the first step in reducing risk. Combined with the right protective measures like PPE and good hygiene, you can minimize your exposure and help prevent the spread of disease. Reducing your risk of exposure to infectious and communicable diseases is one of the most important aspects of working in EMS. To help ensure your safety, several organizations have developed and enforced guidelines for the workplace. The Occupational Safety and Health Administration, OSHA, is responsible for creating and enforcing workplace safety standards, including those that reduce exposure to hazards like bloodborne pathogens. All EMTs are trained to handle these risks as part of their preparation for the job. The Centers for Disease Control and Prevention, CDC, has developed standard precautions, which are protective measures designed to keep healthcare workers from coming into contact with blood, body fluids, or potentially infectious materials. These precautions are based on the principle that every person could potentially be infected or capable of spreading an infectious organism in the healthcare setting. Here's what these precautions involve. Treat every patient interaction as though there's a potential for infection, and apply strict infection control procedures to reduce your risk. Use PPE, hand washing, and safe equipment handling as your frontline defenses. The term universal precautions, often referenced by OSHA, means the same thing. Assume exposure is always a possibility, and take appropriate steps to protect yourself. Finally, if you think you've been exposed, it's critical to notify your designated officer immediately. Timely reporting allows for proper follow-up care and ensures everyone's safety moving forward. By staying informed and vigilant, you can significantly reduce your risk while continuing to provide exceptional care to your patients. Properly putting on and taking off personal protective equipment, PPE, is critical for minimizing contamination and protecting yourself from exposure to infectious diseases. The process might feel routine after a while, but following a consistent sequence every time is essential for safety. When donning PPE, start with your mask to protect your respiratory system. Add eyewear or a full face shield for eye protection, followed by your gown to shield your clothing and skin. Finally, put on your gloves, making sure they cover the cuffs of your gown to create a complete seal. When it's time to remove your PPE, the sequence matters just as much to avoid contamination. Begin with the gloves, carefully peeling them off without touching the outside surface. Remove your gown, turning it inside out as you take it off. Next, take off your eyewear or face shield without touching the front surface. Finally, remove your mask, handling only the straps to avoid contact with the potentially contaminated front. Each component plays a specific role in keeping you safe from airborne particles, fluids, and contaminants. Skipping steps or rushing through the process increases the risk of exposure, so stay methodical. Mastering these techniques ensures not only your safety, but also the safety of your patients and team. This is one skill that's worth practicing until it becomes second nature. When it comes to controlling disease transmission, hand hygiene is your first and best line of defense. It's simple, effective, and something you can do anywhere, but it requires consistency to truly protect yourself and others. Always wash your hands before and after patient contact, even if you're wearing gloves. Gloves provide a barrier, but they aren't foolproof, and hand washing ensures any contaminants are fully removed. If running water isn't available, a waterless hand washing substitute, like an alcohol-based hand sanitizer, is a solid alternative. Just make sure it contains at least 60% alcohol to be effective against most pathogens. Please be warned, though, hand sanitizer does not replace hand washing. The alcohol won't always completely kill what's on your hands, and the lack of running water to irrigate your hands means whatever was there is still there. This small act of washing your hands has an outsized impact on reducing the spread of infection. It's not just a recommendation, it's a standard that protects both you and your patients. Make it a habit every single time. Gloves are a crucial part of personal protective equipment, acting as a barrier between you and potential exposure to blood or body fluids. This step is so critical that in any skill you perform in class, you will automatically fail at step 1 if you do anything other than either don or verbalize donning your gloves. Anytime there's a chance of exposure, make it a habit to wear them. You'll encounter different types of gloves, including vinyl, nitrile, and latex, which are all effective for patient care. When it comes to tasks like cleaning the ambulance or handling heavily soiled equipment, heavy-duty gloves provide the extra protection you need. It's important to change gloves between patients to prevent cross-contamination. This simple step protects both you and those you're caring for. When removing gloves, technique matters. There's a specific method to peel them off without touching the outside surface, which may be contaminated. By practicing this technique, you ensure that you don't inadvertently expose yourself to harmful materials. Gloves are one of the simplest tools you have for infection control, but their effectiveness depends on how and when you use them. Treat them as an essential part of your routine and always handle them with care. Eye protection and face shields are essential when there's a risk of exposure to blood splatters or other body fluids. Your eyes are highly vulnerable to infectious particles, so it's important to shield them effectively. Keep in mind that prescription glasses don't provide adequate protection. They may cover your eyes partially, but they aren't designed to prevent splatters or airborne contaminants from reaching your face. For full protection, goggles or face shields are the best options. They create a barrier that fully covers your eyes and, in the case of a face shield, protects your entire face. This is especially important during procedures or situations where fluids might spray unexpectedly. Using proper eye protection isn't just about following protocol. It's about ensuring your safety every time you respond to a call. Make it a non-negotiable part of your routine. In the old days, gloves used to be the only real standard precaution, but eye protection is becoming part of the baseline, as you can see when watching educational videos in the medical field. The responders are now always putting safety glasses on alongside their gloves. Gowns play a critical role in protecting you during situations where there's a high risk of exposure to blood or other bodily fluids. Just know that this isn't always necessary. Don't show up to a stub toe looking like you're preparing for a hazmat scene, or you'll alienate your patient. Gowns provide an added layer of defense, particularly when you're dealing with extensive blood splatter. There are specific scenarios where wearing a gown is highly recommended. For example, during aerosol-generating procedures such as intubation, where airborne particles pose a risk. Gowns are also essential during the field delivery of a baby or when managing a major trauma, where the potential for large amounts of bodily fluids is significant. By incorporating gowns into your PPE routine in these high-risk situations, you're taking a proactive step to protect yourself and maintain a safe working environment. OSHA masks, respirators, and barrier devices are essential tools for protecting yourself and your patients, particularly in situations involving infectious diseases or respiratory risks. A standard surgical mask is effective for guarding against fluid splatter. However, if you suspect the patient has an airborne or droplet-spread disease like tuberculosis, influenza, or COVID-19, it's critical to take additional precautions. Place a surgical mask on the patient and wear a particulate air respirator such as an N95 yourself. In these scenarios, protective eyewear, whether safety glasses with side shields, goggles, or a full-face shield, is also required to fully protect your face from airborne or fluid risks. If the patient requires oxygen, use a non-rebreathing mask instead of a surgical mask, and set the flow rate between 10 to 15 liters per minute. This approach provides the necessary oxygen while still helping to contain potential respiratory particles. For your N95 respirator to be effective, it must comply with OSHA guidelines and be properly fit tested to ensure it creates a secure seal. Without a proper fit, the mask won't provide adequate protection. In situations where resuscitation is needed during an airborne virus outbreak, mouth-to-mask or mouth-to-mouth resuscitation is recommended as it minimizes aerosol spread compared to other methods. Avoid bag mask ventilation during epidemics like COVID-19, as it is an aerosol-generating procedure that increases the risk of exposure. These practices are vital for reducing transmission risks while ensuring you can deliver effective care in even the most challenging conditions. Proper disposal of sharps is a critical step in preventing exposure to serious infections like HIV and hepatitis. Handling sharps safely protects you, your team, and anyone else who may come into contact with your workspace. One key rule is to never recap, break, or bend needles after use. These actions increase the risk of accidental sticks, which can lead to exposure. Instead, immediately place used sharps in an approved closed, rigid container designed specifically for safe disposal. By following these guidelines consistently, you minimize the chance of injury and help maintain a safe environment for everyone. Proper sharps disposal isn't just a safety measure. It's a responsibility that protects lives. As an EMS professional, the risk of exposure to communicable diseases is an inherent part of the job. While this risk can't be eliminated, there are clear responsibilities your employer must meet to help minimize it and keep you safe. Your employer is required to follow OSHA guidelines as well as other national standards designed to reduce exposure to bloodborne pathogens and airborne diseases. These regulations set the baseline for workplace safety, including the provision of proper training, equipment, and protocols. It's also essential for you to familiarize yourself with your department's infection control plan. This plan outlines specific procedures tailored to your workplace, ensuring everyone knows how to handle potential exposures effectively. Following these protocols not only protects you, but also supports a safer environment for your coworkers and patients. Employer responsibilities are a vital part of a shared effort to manage and reduce risks. By knowing the guidelines and sticking to them, you play an active role in maintaining a safe and healthy work environment. Creating and following an infection control routine is essential for minimizing exposure and maintaining a safe environment. Consistency is key. Every step you take reduces the risk to yourself, your team, and your patients. One of your primary responsibilities is cleaning and decontaminating the ambulance and equipment. This isn't just an occasional task. It's something that needs to happen after every run and as part of a daily routine. Whenever possible, perform cleaning at the hospital where the necessary supplies and disposal facilities are readily available. Here are some key points to remember. Place any medical waste into a red biohazard bag and dispose of it at the hospital. Contaminated equipment left at the hospital should be either cleaned by hospital staff or transported back to your station in a red biohazard bag. Use a bleach and water solution at a 110 dilution or a hospital-approved disinfectant, effective against Mycobacterium tuberculosis, to clean surfaces and equipment. Remove contaminated linen and place it into an appropriate bag for handling to ensure safe disposal. For reusable medical equipment, follow your department's standard operating procedures for cleaning and sterilization. Proper handling of these items ensures they're safe for future use and reduces the risk of contamination. A clean ambulance and properly sanitized equipment aren't just about appearances. They're critical for infection control and ensuring the safety of every patient and provider. Make it part of your routine every time. Even when you're exposed to germs, you're not automatically at risk of infection. Your body's immunity plays a significant role in determining whether those germs can make you sick. Immunity is your body's ability to resist particular germs. It's a defense system that helps protect you from illness, and it can develop in a couple of key ways. Through immunizations or vaccinations, which prepare your immune system to recognize and fight off specific pathogens. By recovering from an infection, which often leaves your body better equipped to resist the same germ in the future. This natural or acquired resistance means that even in a high-risk job like EMS, your immune system can provide a critical layer of protection. Staying up to date on vaccines and maintaining your overall health helps strengthen this defense, keeping you safer on the job. Immunizations are a cornerstone of infection prevention for EMS professionals. They provide a crucial layer of protection, ensuring your immune system is prepared to fight off specific diseases you may encounter on the job. Start by keeping a detailed record of your childhood infectious diseases. This file should include illnesses like chickenpox, mumps, measles, rubella, and whooping cough. Knowing your history helps you and your employer understand which vaccines or boosters you may need. The Centers for Disease Control and Prevention, CDC, provides immunization guidelines specifically for healthcare workers. These include hepatitis B, which is required by OSHA due to the risk of bloodborne pathogen exposure. Influenza, recommended annually to stay ahead of evolving flu strains. Measles, mumps, and rubella, MMR, which protect against these highly contagious diseases. Varicella, either through a vaccine or documented history of chickenpox. Tetanus, diphtheria, and pertussis, TDAP, with boosters every 10 years to maintain immunity. Additionally, healthcare workers should have a skin test for tuberculosis before starting their job and repeat it annually. Tuberculosis remains a serious threat in certain environments, so consistent monitoring is essential. Keeping your immunizations current isn't just about protecting yourself, it's about ensuring the safety of your patients and colleagues. Treat this as a professional responsibility and part of your ongoing health maintenance. Exposure to a patient's blood or bodily fluids is a serious situation that requires immediate and methodical action to minimize risk and ensure proper follow-up. Here's how to handle it. If an exposure occurs, your first step is to turn over patient care to another EMS provider. This allows you to focus on managing the exposure safely. Next, clean the exposed area thoroughly. Use soap and water to wash the affected skin, and if your eyes were exposed, rinse them for at least 20 minutes with clean water or saline. From there, activate your department's infection control plan. This ensures that appropriate protocols are followed and that any necessary steps for your safety and the safety of others are taken. You will also need to complete an exposure report and undergo screening to determine if the exposure was significant, particularly for bloodborne pathogens. If exposed to a highly communicable airborne disease such as COVID-19 and you weren't properly protected with PPE, you may be required to quarantine for a specific period of time based on guidelines. In cases of significant exposure, you may also receive post-exposure prophylaxis, PEP, and other treatments, depending on the risk level and type of exposure. Taking swift, organized action in these situations protects your health and ensures that you're following the necessary protocols for recovery and prevention. Scene safety is one of your most important responsibilities as an EMS provider. Ensuring the safety of everyone involved, yourself, your team, and bystanders, starts the moment you're dispatched and continues throughout the call. From the very beginning, take steps to protect yourself. Always wear your seatbelt while in the ambulance to reduce the risk of injury during transit. Before arriving, make sure you've donned the appropriate PPE for the situation. Once you're on scene, maintaining safety is an ongoing process. Ensure the scene is well marked to alert others to your presence, and use warning devices like cones or flares to warn motorists if you're near roadways. Parking the ambulance is another key safety measure. Park at a safe distance from the scene to avoid hazards like fire, smoke, or unstable structures. If it's dark, make sure the area is well lit. Using scene lights or portable lighting is needed. Additionally, always wear reflective clothing to increase your visibility and reduce the risk of being struck by a vehicle or unseen in low light conditions. Your safety is a top priority because you can't help others effectively if you're injured or at risk. By staying vigilant and following these practices, you set the stage for a safer and more efficient response. When responding to emergencies, it is important to stay aware of scene hazards that may put you, your team, or your patients at risk. Identifying and managing these hazards ensures a safer response. For hazardous materials, observe the scene from a safe distance. Use binoculars to read any labels, placards, or identification numbers. Never enter the scene unless it is confirmed to be safe. Patients exposed to hazardous materials must be decontaminated before care begins. Reference tools such as the U.S. Department of Transportation's Emergency Response Guidebook or smartphone apps to determine the appropriate procedures. Always stay upwind and uphill, maintain a safe distance, and request specialized hazardous materials teams. Electricity is another significant hazard. Downed power lines must be avoided. Establish a danger zone using utility poles as reference points, keeping at least one pole's length away. Never touch wires or anything in contact with them until utility personnel confirm it is safe. Lightning also poses risks. Avoid high ground, moist areas, or drainage ditches to reduce the chance of ground current injuries. If lightning is nearby, drop all equipment and minimize your profile to reduce the risk of a strike. Fires present hazards such as smoke, oxygen deficiency, high temperatures, toxic gases, building collapse, and explosions. Be aware of these dangers and follow the fire department's lead for maintaining a safe perimeter. Vehicle crashes are a common scene for EMS providers. Risks include traffic, unstable vehicles, downed power lines, leaking fluids, sharp objects, and airbags that could deploy unexpectedly. Wear appropriate protective gear and remain vigilant to minimize the risk of injury. Scene hazards vary, but recognizing and managing them is vital to protecting yourself and others while delivering care. Violent incidents may include assaults, hostage situations, riots, or other disturbances. Your assessment of the scene should start while you are en route. Listen for updates from dispatch and gather as much information as possible. Once on scene, continue assessing by combining your own observations with input from law enforcement and other responders. Always prioritize personal and team safety above all else. In cases of mass violence, multiple agencies will likely be involved. It is important to understand who is in command and follow their direction. Stay vigilant for ongoing or potential threats and never approach the scene until law enforcement has secured it. If projectiles are involved, seek protection. This may involve cover, which is the use of an impenetrable barrier to protect yourself. Concealment, which involves hiding behind objects to limit visibility to a potential threat. If the incident is a crime scene, try to maintain the chain of evidence and disturb the scene only when necessary to provide life-saving care. Violence against responders is a significant risk. The rate of violence-related injuries resulting in lost work time for emergency responders is 22 times higher than for other workers in the U.S. Preventive measures include training to identify potential threats, practice in de-escalation techniques and interpersonal communication. Ensuring dispatch provides warnings about past or potential threats. For personal protection, recommendations include training in self-defense and escape techniques, practice in physical and chemical restraint methods, proper fitting and use of body armor, training in collaborative operations with law enforcement. Violent scenes demand heightened awareness, caution, and preparation. By practicing these strategies, you can reduce risks and remain focused on providing care in the safest possible way. PPE is essential for your safety. Wearing the right gear not only shields you from physical harm, but also helps you stay comfortable and effective in challenging environments. Begin by familiarizing yourself with the PPE available to you and inspecting it regularly, ideally before reaching the scene. Damaged or faulty gear can't protect you, so early checks are crucial. Cold weather clothing should consist of 3 layers. A thin inner layer to wick moisture away from your skin, a thermal middle layer for insulation, and an outer layer to protect against the elements. Turnout gear, also known as bunker gear, protects you from heat, fire, sparks, and flashover during rescue operations. Gloves are important for protection against heat, cold, and cuts, though they may reduce dexterity in certain rescue situations. Helmets should always be worn when working in a fall zone. Choose helmets that provide both top and side impact protection, have a secure chin strap, and include a face shield for situations involving electrical hazards. Boots should be water-resistant, well-fitting, and flexible. Steel-toed boots with good traction are preferred for rescue situations. For eye protection, wear glasses with side shields during routine care, and use a face shield or goggles when tools are in use. Ear protection such as foam earplugs can safeguard your hearing in noisy environments. Skin protection is essential for outdoor work. Use sunscreen with an SPF of at least 15 to prevent sunburn. Body armor ranges from lightweight and flexible to heavy and bulky. While not practical for daily use, vests can offer valuable protection in high-risk scenarios. Keep in mind, they may not guard against rifle ammunition or stabbing attacks. Lastly, consider how hair, rings, and jewelry might interfere with safety. Many EMS services require hair to be tied back neatly and limit the number of rings worn. Ideally, wear only a wristwatch to avoid entanglements or hazards. Providing care for critically ill and injured patients requires both clinical skill and compassionate communication. Patients in these situations often feel vulnerable, so how you interact with them is as important as the care you deliver. Start by introducing yourself and explaining what you're doing. Reassure the patient that your focus is on their immediate needs. Avoid making unprofessional comments during resuscitation or care. Words matter and professionalism conveys respect and confidence. When communicating, use specific techniques to help reduce stress and anxiety. Avoid sad or grim remarks, as these can increase the patient's fear and hinder recovery. Instead, use brief statements to orient the patient to their surroundings and the care you're providing. Be honest, but consider how much information the patient can process. Involve them in their care where possible to give them a sense of control. Above all, allow for hope. Even a small, honest expression of optimism can have a positive impact. For family members, assure the patient that you will take care of notifying the appropriate people. Knowing their loved ones are informed can provide comfort during a chaotic time. When caring for critically ill children, treat them with the same respect and dignity as adults, but recognize the unique need for reassurance. Whenever possible, have a relative or responsible adult accompany the child to reduce anxiety and provide support. Dealing with the death of a child is one of the most difficult situations in EMS. Help the family navigate the immediate aftermath with compassion. Acknowledge the death in a private space and prepare them for common reactions such as shock or denial. If circumstances allow, let the parents hold or see the child and guide them through what to expect. Be mindful not to overwhelm grieving parents with information. Let their actions and needs guide your support. As an EMT, you will inevitably encounter death and dying in the course of your career. Death may happen in a variety of ways, either suddenly, such as in a traumatic event, or after a prolonged terminal illness. While these situations are never easy, your role is to provide professionalism, compassion, and support to those involved. The grieving process often follows a predictable path, though everyone experiences it differently. The 5 stages of grief are: denial, where the reality of the loss is difficult to accept; anger or hostility, often directed at the situation, others, or even you as the provider; bargaining, where individuals focus on if-only scenarios; depression, as the weight of the loss sets in; acceptance, the final stage, where peace is found with the situation. Your response as an EMT can have a significant impact during these moments. Here's what you can do. Ask the patient or family if there is anything you can do to help. Sometimes small actions make a big difference. Reinforce the reality of the situation with honesty and sincerity. Avoid offering false hope or making assumptions about their feelings. Be careful not to say you know how they feel. Grief is deeply personal, and acknowledging their unique experience is key. Something else that's said often and many times looked at as a brush-off or insult is anything to do with thoughts and prayers. So be careful with those kind of responses as well. Allow the patient or family to grieve in their own way and support them as they process their emotions. Your presence during these moments can provide stability and comfort. Approach these situations with empathy, respect, and patience, knowing that your actions and words can help ease some of the burden during one of life's most difficult experiences. Working in EMS is inherently high stress, and managing that stress is vital for your health and performance. Understanding the causes of stress and how to deal with it is just as important as any clinical skill. Stressors in EMS can come from a variety of sources, including emotional situations like handling critically ill patients or grieving families, physical demands such as long shifts, lifting, and working in challenging environments, environmental factors like loud noises, extreme weather, or dangerous scenes. Your body reacts to stress in stages, a process known as general adaptation syndrome. The first stage is the alarm response, when your body recognizes a threat and prepares for action. This is followed by the reaction and resistance stage, where you adapt to the stress and try to cope. If stress persists without resolution, it can lead to the exhaustion stage, where your body's resources are depleted, increasing the risk of burnout and illness. Stress also causes physiological changes in your body, which you've likely felt in intense situations. These include increased respirations, heart rate, and blood pressure, dilated pupils and tense muscles, preparing your body to act quickly, cool, clammy skin due to dilated venous vessels near the surface, higher blood glucose levels as your body releases energy reserves, perspiration and reduced blood flow to the gastrointestinal tract, which explains why digestion can slow during high stress. Recognizing these signs in yourself is the first step to managing stress effectively. Over time, unchecked stress can take a toll, so learning how to address it proactively is key to maintaining your resilience and longevity in this career. As an EMS provider, you'll face many situations that can test your physical and emotional limits. Recognizing the types of scenarios that are particularly stressful is a key part of managing their impact. Some of the most common stressful situations include dangerous environments where your personal safety is at risk, the intense physical and psychological demands of the job, which can take a toll over time, caring for critically ill or injured patients, where the stakes are high and decisions must be made quickly, encounters with dead or dying patients, which are emotionally challenging, especially if families are present, overpowering sights, smells, and sounds that can overwhelm your senses and stay with you long after a call. Other stressors include multiple patient situations, which require rapid coordination and prioritization, dealing with angry or upset patients, family members, or bystanders, which can create additional tension. The unpredictability and constant demands of EMS work, which can disrupt routines and increase fatigue. These challenges are inherent to the job, but they don't have to lead to burnout. Recognizing which situations stress you the most allows you to develop strategies to manage them effectively, ensuring you can continue providing excellent care while protecting your own well-being. Stress is an unavoidable part of EMS work, but understanding the different types of stress reactions can help you recognize and manage their effects. Acute stress reactions occur during a stressful event. These immediate responses may feel overwhelming, but typically subside as the situation resolves. Delayed stress reactions, on the other hand, appear after the event, sometimes hours, days, or even weeks later. These can catch you off guard as the initial adrenaline wears off and the emotional impact sets in. Cumulative stress reactions result from prolonged or excessive stress over time. This type of stress builds gradually, often without you realizing it, and can lead to burnout or more serious health concerns. Stress can manifest in physical symptoms such as fatigue, headaches, or changes in appetite, gastrointestinal problems like nausea or stomach pain, sleep disturbances including insomnia or hypersomnia, increased irritability, difficulty concentrating, or changes in activity levels like hyperactivity or lethargy. Psychological symptoms include fear, depression, or guilt, oversensitivity, frustration, or anger, feeling emotionally dull or disconnected, which can affect how you respond to others. In some cases, severe stress may come from critical incidents, such as mass casualty incidents, the serious injury or traumatic death of a child, crashes involving injuries caused by an emergency provider en route to a call, the death or serious injury of a coworker in the line of duty. Recognizing these reactions, whether physical, psychological, or linked to critical events, is the first step in addressing them. Managing stress effectively not only helps you stay healthy, but also ensures you're able to continue providing the high level of care your patients need. Stress from a critical incident can linger long after the event is over, especially if it involves a psychologically distressing situation. This type of stress reaction may result in re-experiencing the event or having an exaggerated response to stimuli that recall it. Recognizing these signs is essential for maintaining your mental health. One effective approach to managing critical incident stress is Critical Incident Stress Management, CISM, a structured process designed to help emergency providers process and relieve stress. CISM can occur in two main formats. Diffusing sessions held during or immediately after the event provide a quick opportunity to address immediate stress. Debriefing sessions held 24 to 72 hours after the incident allow for a deeper discussion of the emotional impact. An important rule in CISM is to avoid turning a debriefing session into an operational critique. The focus should remain on stress relief and emotional support, not on analyzing response logistics. If CISM is unavailable or doesn't meet your needs, private counseling with a mental health professional may be a preferable option. Individual counseling offers a personalized approach to managing stress and addressing its long-term effects. Taking steps to address critical incident stress helps safeguard your mental health and ensures you're prepared to face future challenges. Support systems like CISM and counseling are essential tools for maintaining resilience in the field. Burnout is a serious issue in EMS and describes a combination of exhaustion, cynicism, and reduced performance caused by prolonged job stress. It's more than just feeling tired, it's a state of physical, emotional, and mental depletion that can have far-reaching effects. Burnout not only impacts the well-being of the EMT, but also affects colleagues and patients. It can lead to increased rates of major medical errors, higher occurrences of healthcare-associated infections, increased patient mortality as stress undermines decision-making and performance. Burnout also negatively affects the work environment by lowering morale, reducing teamwork, and decreasing overall work effort. It can reduce patient satisfaction and lead to increased job turnover, which strains both providers and the system as a whole. Recognizing and addressing burnout early is critical. By staying proactive about managing stress, fostering supportive team dynamics, and seeking help when needed, you can prevent burnout from taking hold and protect your ability to provide high-quality care. Compassion fatigue, also called secondary stress disorder, is a common challenge among healthcare providers, including EMS personnel. It occurs when the constant demands of caring for others begin to erode your ability to feel compassion over time. This condition develops gradually and can affect your emotional well-being and professional performance. Symptoms of compassion fatigue include high absenteeism as work becomes more overwhelming, strained or difficult relationships with colleagues and coworkers, an inability to work in teams which can affect collaboration and patient outcomes, aggressive behavior or a judgmental attitude toward patients, reflecting growing frustration, a negative outlook on work and a lack of empathy for the people you're caring for, preoccupation with non-work issues while on duty, causing distractions that impact performance, other signs of stress like irritability or burnout, further compounding the issue. Compassion fatigue doesn't mean you're failing. It's a sign that your own emotional reserves need attention. Recognizing these symptoms early and addressing them through stress management, peer support, or professional counseling can help you regain balance and reconnect with the compassion that drives your work. Suicide is a serious concern in the EMS profession. Studies show that the suicide rate among emergency responders is significantly higher than that of the general population. This highlights the immense emotional toll that comes with the job. Job stress is widely recognized as the largest contributing factor. The high-pressure nature of EMS work, exposure to traumatic events, and cumulative stress over time can all weigh heavily on mental health. It's important to remember that help is available. Organizations and mental health services are specifically designed to provide emotional support for emergency responders. These include crisis hotlines, peer support programs, and professional counseling services. Seeking support isn't a sign of weakness, it's a vital step in protecting your well-being and ensuring that you can continue serving others while taking care of yourself. If you or a colleague are struggling, reach out. Help is there when you need it. Providing emergency care comes with significant emotional challenges, even for the most seasoned healthcare providers. There are moments when the gravity of a situation may feel overwhelming, making it difficult to push past personal reactions and proceed with the necessary actions. Remaining calm and composed in the face of horrible circumstances such as traumatic injuries, loss of life, or intense family emotions is a core part of the job. However, this effort to stay steady under pressure often adds to the emotional stress you carry. Recognizing that these feelings are normal is important. They're a natural human response to extraordinary situations. The key is learning how to manage those emotions in the moment and addressing their long-term effects through stress management strategies, peer support, or professional help when needed. Caring for others begins with taking care of yourself. By acknowledging and addressing the emotional toll of emergency care, you protect your well-being and ensure you're able to continue making a difference for those who rely on you. In stressful situations, maintaining professionalism in both your words and actions is critical. These moments often require calm, composed leadership to stabilize the scene and provide the best possible care. Patients react to EMS incidents in different ways, influenced by a variety of factors, including socioeconomic background, which may shape expectations or fears, fear of medical personnel, common in those with little healthcare experience, alcohol or substance use disorders, which can complicate behavior or communication, chronic illnesses or mental health conditions, which may alter how patients perceive the situation, medication reactions, age, and nutritional status, which can affect both physical and emotional responses, feelings of guilt or past experiences with illness or injury, which might heighten anxiety or distress. As an EMS provider, it's essential to quickly and calmly assess the actions of the patient, family members, and bystanders. Use a professional tone at all times, demonstrating courtesy, genuine concern, and efficient action. Providing patients with the opportunity to express their fears and concerns can help them feel more secure and understood. Additionally, you must respect the religious customs or needs of your patients. Some individuals may have convictions that oppose the use of medications, blood, or blood products. It's important to respect these beliefs and report them to the next level of care. In the event of a death, handling the body with respect and dignity is essential. How you act in these moments leaves a lasting impression on family members and bystanders. Your ability to navigate stressful situations with professionalism and compassion ensures both effective care and a sense of stability for everyone involved. All right, let's quickly recap what we've covered in this chapter. We started by exploring the importance of workforce safety and wellness, emphasizing that to take care of others, you must first take care of yourself. This includes maintaining your physical, mental, and emotional health through proper nutrition, exercise, sleep, and stress management. We looked at infection control practices, like proper hand hygiene, using personal protective equipment such as gloves, masks, and gowns, and safely handling sharps. Understanding the routes of transmission and how to decontaminate equipment and ambulances were also key points. From there, we discussed scene safety, focusing on recognizing hazards like electricity, hazardous materials, and vehicle crashes. You learned how to assess for dangers, stay vigilant in violent or mass casualty situations, and protect yourself with tools like reflective gear and proper parking strategies. Next, we covered the emotional aspects of the job, from dealing with death and dying to managing stressful situations like critically ill patients, angry bystanders, or challenging family dynamics. We broke down the stages of grief, how to communicate effectively, and the role of cultural humility in building trust with diverse populations. We also discussed workplace issues, including harassment, substance abuse, injury prevention, and cultural diversity. You learned how to foster respectful relationships, address problems like burnout or compassion fatigue, and seek support from employee assistance programs or critical incident stress management teams when needed. Finally, we emphasized the importance of maintaining your well-being while performing under pressure. By practicing professionalism, self-care, and teamwork, you can stay resilient in the face of the challenges this career brings. Before we wrap up, make sure you've checked the QR code on the slide to mark your attendance. Great job today.